Next, we'll be going into specialty nurses, and this has a lot of variety of different types of nurses, and the differences between them are very obvious. Starting off with emergency room nurses or ER nurses, is they have their education usually makes up of associate degrees in nurses (ADNs) or bachelor's degrees in science of in nursing (BSNs), and they are required to take the RN license, which is the NCLEX RN licensure exam, which is the National Certification Licensing Examination of Registered Nurses. And they are required to get certificates in base life of sciences, is advanced cardiovascular life support, or which are BLSNs, BLS, and then an ACLS, and as they are in the emergency room where a lot of things happen, they're gonna need a lot of certifications, including in trauma nursing core courses, which is TNNC, which again you don't know what you can see or what happens in there, and just expect the unexpected. The emergency nursing pediatric course, which is an ENCP, because again, all types of people, elderly, adults, children, teenagers, they all come to emergency for a variety of reasons, and you need to be able to help them all. And they have what they do is basically they assess all the patients that come into the ER, or there is no really limit on how many of what they can do, as if they come into the ER, it's dangerous and sometimes most likely life threatening, not all the time. And they need to be cited, and just like they can basically assess not everything, but most of everything in the base level. Stabilize trauma and emergency, like stabilizing trauma and emergency patients, administrating medication and IV, and collaborate with like emergency medical teams. Say like, oh, they need to be rushed into surgery or anything, they are prepared to do that at all times of the day. Next one is an intensive care unit and an ICU nurse. And they also, in education wise, require an ADN or a BSN and degree, and also have to take the RN licensure exam. They they also have in common certificate wise, of having to get certified and certificates in a BLS and a ACLS. But the difference is that they have to get a critical care registered nurse and CCRN, and it's optional, but it is preferred, and most people that have this will get hired more often than people that don't. Scope of practice, which is like what they do. They monitor and manage critically ill patients, people like that are on ventilators, defibrillators, and infusion pumps, and they administer high risk medication because they are certified and trained to do so, especially if it's in more areas where they're like more prone to choking or stuff like that. And they collaborate with multidisciplinary teams. So if the patient is stable, they'll be able to put it in a room and take it off critical care. They can help them and transfer them. But if they get into more critical care where they need to be have surgery right away, they can also help go into surgical. That's something that sometimes they go on and off basis. Next up is a neonatal intensive care unit, or an NICU nurses, which are basically an ICU nurse that works on specifically newborns. And although it is not required, it is preferred that you do have a BSN, a bachelor's degree in science of nursing, and of course you have to be have your RN license, and as well as the others, they do have to have a BLS certification, but although they need an NRP, which is a neonatal restructural program, and an CRNIC, which is an optional neonatal certification, but again, it is often and more recommended and often gives you more chances in that field. They provide, like I said, they provide for intensive care for newborns. They monitor the vitals and signs and administer the nutrients and meds as needed for these newborns, especially for children who are malnourished, not in the sense for since if the mother's body didn't give enough and it's not the mother's fault, or if the child is born or earlier than usual, and they support families and emotionally and educationally to see what are the next steps are, or prepare them for the worst if they have to. Next up is pediatric nurse, and these you're okay with getting away with an associate's degree in nursing, but again, it's preferred if you have a bachelor of science of nursing. In most things, they'll say that you can stay with an associate's degree of nursing, but it is preferred that you, in any job, that you go for the higher education, as they will most likely go for the person with the higher education, and of course the RN license. Again with a certification of BLS and certification of Pediatric Advanced Life Support, PALS for short, and a certified pediatric nurse and NCP certification, and optional, but again, basically required. And these provide care. These nurses provide care to infants, children, and adolescents. They administrate a they administrate and monitor growth and development of these children, and they educate parents on the wellness and health of their children and how to move steps forward for their health and well-being. Coming up next is a geriatric nurse, again, and a bachelor's science of nursing with an RN's license as well. And this is one of the fewer ones that doesn't need as many certifications to go for the job, but again, getting more certifications is recommended. BLS, which is a basic life support certification, and most of all specialized nurses, if not all nurses, need this certification, and as you're having somebody's life in your hands. And another certification you need is a gerontological nursing certification, an RNBC, and it basically gives you the certification and the right to care for the elderly with chronic illnesses, such as helping them prevent falling, or helping them when they do fall, give them the appropriate medication, and generally help them planning what's next of what's left of hopefully a very long still lived life. There's the education and baseline certification for BLS is basically the same, and the only difference between a non-oncology nurse is that they need to be certified in oncology and a chemotherapy and biotherapy certification, and as they are there to help administrate chemo and radiation and help you manage the side effects of the symptoms and provide psychosocial support to patients and families. Next is psychiatric mental health nurses, and this one you have to have a bachelor's or science of nursing degree. It is recommended that you get a master's in science of nursing, or altogether just go for your a doctorate in nursing and become a nurse practitioner, and like with nurse practitioner roles, and get your RN license, of course. And with getting your basic life support things, you're also getting a psychiatric mental health nursing certification. But if you take the doctorate route, you will have to get a different certification, which is a PMHNP EBC, which is basically the same thing as a as the psychiatric mental health nursing certification, but it is more complicated and it is for the higher degree level. And these types of nurses conduct mental health assessments and administer psychiatric meds and provide counseling and crisis intervention to psychiatric patients, and are often the ones that you see the most in psychiatric facilities, and as psychiatric doctors are very limited, especially when psychiatric doctors are very limited. Next is a cardiac nurse, which is a nurse that works with the heart, and a base level of an ADN, and again recommended if you get a BSN with your RN license. Getting your BLS and an ACLS, a cardiac vascular nursing certificate as well is optional, but again it is recommended. And these types of nurses care for our patients with heart disease, monitoring and telemetry, and managing cardiac medication, and they assist with cardiac procedures on occasion, especially if the patient is critical. Orthopedic nurses have a baseline education of an ADSN and with a registered license and RN license and certification in basic life support, as well as orthopedic nurse certification, and assist with they assist orthopedic surgeons and manage fractures, casts, and tractions, and monitor the post-op complications. And so these are the nurses that will be there when and seeing and looking at the fractures and will, if the doctor's not around and there is no one to help, they will see if the bone is set into the right place, and if not, proceed from there, get a doctor if needed. But they are often able to study for themselves, and yeah. Dialysis nurse they operate dialysis machines and monitor fluid and electrolyte balances, and they educate patients on kidney disease and management, and so they help try to prevent kidney disease, or if kidney disease is already happening, they help take measures to slow down the process or reverse it if possible. And they have certifications in dialysis nursing and in anthropology nurses, as they are pumping your system, and it is technically considered a surgery. And next is an operating nurse. There's an OR nurse, which are and a pre-operative nurse, which are correlating in degrees, and they have the same education, which is a BSN and registered license, basic life support. But operating room and OR nurses usually are not regularly allowed actually in the OR, or unless necessary, and they usually stick to the pre-operative aspect of the OR. And as they are certified in preoperative nursing, CNR, and they prepare patients and instruct them on surgery and how is it going to go, what they can and can't do before the surgery, and they assist surgeons during operations, again, if necessary, and maintain a sterile environment for patient safety, especially since the OR must be sterile at all times or infection can't occur. Then we have hospice nurses, which provide end-of-life care and pain management and support patients emotionally and spiritually, and as they help them on their journey into accepting their death and becoming at peace with it, as well as helping there to help manage the pain so they're not in pain and they're not suffering their entire stay in hospice or at home if they decide to do hospice at home. And they educate and counsel families and prepare them for the inevitable. have a baseline education of an associate's degree of nursing, which is recommended to go to higher education of a bachelor's degree in science of nursing. It is required for the RN and licensing, and they have certification in basic life support and certified hospice and palliative care, or as they help prepare these people for their experience into the afterlife. This is infection control nurses or infection preventionists. Baseline degree of bachelor's science of nursing and your registered RN license. They are certified in infection control and CIC, and they help develop and implement infection control policies. These help the well-being of both the patients and the workers that work at hospitals or private owned establishments. And they monitor hospital-acquired infections, train staff on prevention measures, and PE use, and hand hygiene and how to properly wash hands, how to properly use hand sanitizer, wear gloves, disposal of gloves, and investigate and respond to infection outbreaks. Like I said, these were the first responders for COVID-19. Dermatology nurses assist with the skin exams and procedures. There's like biopsies and laser treatments. And they educate patients on skincare and dermatological conditions and manage chronic conditions like eczema, psoriasis, and acne. They help recommend, not prescribe, certain treatments, and especially if they're on counter, or medications, and for certain types of skin diseases, and work in clinical cosmetic dermatology settings. And so these are the people you would sometimes see in dermatology. These are the people that you would see in dermatology or in plastic surgery, depending on what the plastic surgeon is specialized in. Endoscopy nurse assists with endoscopy procedures and prep patients and provide sedation monitoring, and as a person is going under for an endoscopy, and provide post-procedure care and discharge education, in which they help them recover, like feeding them if they have to, feeding them and bathing them, all that stuff after the thing. And once they're discharged, they're the ones that would give them all the information, or you would go to for all the information of what you're supposed to do at home. And they ensure infection control and equipment sterilization. They make sure there is little chance for infection for the patient, and as much as they can. And they need a certification in gastropathy and registered nursing, as well as in a BLS and ACLS certifications. Plastic surgery nurses is help with pre and post-op care for cosmetic reconstructive procedures or plastic surgery, and they assist in surgical and non-surgical treatments like Botox and like laser and like doing the lines on your face, and seeing where everything's gonna go, what they're gonna change, and they monitor patient recovery and healing, make sure there's no infection, make sure the skin is smooth, it's seamless, and they educate patients on post-surgical care and expectations, what they can and can't do, what they can and can't eat, to avoid the sun if they have to, especially if it's a large surgical area, and what they can and can't wear restrictively, if like restrictive clothing is an option or not, especially so soon after surgery, and when they can start doing those things again. And one of the nurses, what I found most interesting, are parish nurses or faith community nurses, and They focus on spiritual and emotional and physical health within the faith community, provide health education and referrals and advocacy inside their faith and their community, and promote wellness through faith-based programs, and does not typically provide hands-on clinical care. These are often people you see parading with people who don't believe in certain medical procedures and try to find alternatives, and the family or the church will come with that person, and you will sometimes see this person in these type of people with this faith group. And faith community nursing courses are endorsed by an American Nurses Association and Health and Minister Association, and you cannot become one without that endorsement. In additional training in parish and faith community nurses, often certificate programs in religion, and you, as well as you need an RN license and a baseline of an associate's degree in nursing.